So thank you for the opportunity to present the work that we did around the electronic health record in Switzerland and mHealth. So before I start with my presentations, I would like just to say some few words about eHealth Swiss, because this helps you to understand why we did proceed as we done. So we were founded in 2008 from the Federation and the 26 cantons. So in Switzerland, you have 26 regions, and it's important to know that for the health sectors, the cantons are actually, the 26 regions are responsible for it. So if you want to implement a nationwide IT project like the EHR that we are implementing this next year, you have actually to take care of 26 health laws, 26 data protection laws. So it's quite a complicated thing, and that's why eHealth Swiss was founded to actually coordinate all the work over these implementations of the EHR. So as I said, we are implementing an electronic health record, and for this we published in 2007 the eHealth strategy, and the EHR is actually the heart of this strategy. And it aims actually to make data around the treatment accessible for all the health professionals that are involved in the treatment of the patients. So you will find in your personal EHR like documents like the medical list or the X-ray findings, or also the discharge report, for example. And all these documents or informations are created and also uploaded by the health professionals. But patients would also like to share documents and information that they collect themselves with the health professionals through the EHR. So we actually written an article in the federal law on the electronic health record that makes this possible on the legislative side. But we also wanted to enable them not just to upload information through their computer, but also through mobile devices. So therefore, we written the article in the law firstly, but we wanted, as I said, it's just one side of the story. We wanted also to assure that the conditions to enable this were here, that they were in place. So we created a working group with experts and looked actually on 5 topics or themes around the mHealth field. This was regulations of medical devices, data protections and security, reimbursement, interoperability, and empowerment of professional mHealth users. And as we started the discussions in this working group, we actually saw with experts that the legislation was so far given, it was okay. There was no need to make new law, but there was a lack of transparency. So we worked very hardly on recommendations that we are now making in place. I would like to present the work that we've done around these recommendations. And for that, I would like to highlight 3 of these 5 topics. This is regulations of medical devices, interoperability, and empowerment of potentials mHealth users. So now to start with the regulations of the medical devices, there we saw actually that some of the app developers didn't know that their product actually was a medical device and should go through the certifications process. So we elaborated to help them actually a guide, a practical assistance, so they could easily make the difference if the product was a lifestyle product or a medical device that had to go through the certification process. And the guide also helps them or guides them through the certifications process, and is also goes also with a checklist. So This guide or this practical assistance was published and is also available in English if you are interested to have a look in it. Then for interoperability, as I said, we want that patients can share data with the health professionals through mobile devices. And there's, of course, the challenge that they will use different mobile devices to share data through the EHR with their health professionals. So for us, it was very important to assure interoperability. So the first thing we did was we elaborated a report with recommendations for the use of technical standards and norms in the mHealth field. And all these standards are also used internationally, so in other countries. So we really looked that there were international standards, actually. On basis of this work, we did a rough concept for connecting mobile devices to the EHR, and then we adjusted IHE profiles to assure that the apps could be connected to the EHR. And we tested actually the EHR profiles this year in our PREREQUISITES. This is a testing event around the EHR. And the next step is that we would like to adopt and implement these profiles into the EHR regulations. Then we also would like to create more transparency for the app users, because there are really a lot of apps for the health sector. And it's quite difficult for the users to find transparent product information. So if you use an app, often you ask yourself, where's the data stored? Who owns the data? When I use this app, are the measurements reliable? So we decided also here to create a list of criteria, actually self-declarations that could be filled out by the app developers, so that the app users have the information that they need to decide if an app is good for the purpose that they want to use it or not. So we focused actually on the work of 9 generic criteria, with the idea that all the users of this self-declaration can find the information that they need. So if, for example, an oncologist would like to recommend an app to a patient, that he could look on this web platform where the self-declarations will be published, and find the information that he needs and be sure that the app that he is recommending is okay for his patients. So the idea would also be that if, for example, a health professional association would like to recommend apps for the target group, that they could look at the information on this web platform, decide if they want to recommend the app, perhaps also test it, and then give the label to this app, the recommendation label to this app also on this web platform, so that the patients also could see that it's recommended, so that the patients and the health professionals could see that it would be recommended by this health professional association. So the next steps now are to develop a first mock-up through next year of this web platform, also with the relevant stakeholders, so that we assure that their needs, that we can take account of their needs, and to implement then this final platform in 2022. So our main aim is actually to create around the EHR an interoperable environment, so that the EHR, of course, is interoperable, but also all the mHealth services around it, but also the additional interoperable services like B2B or B2C services around the EHR. So this is what my presentation contains. If I can answer your questions. If there are any, I would really gladly do this.